We've looked at the world through different lenses to understand some of the inequalities that face us when thinking how to meet the challenges of deafness in the 21st century. Now we are going to focus more on who is affected and the complex situations that surround such individuals. More than 5 billion people, or over 8% of the world's population, live in low and middle income countries. Of all children globally, 90% live in these countries, where low life expectancy, poor access to education and a poor standard of living are likely to include poor access to clean water and undernourishment, and these are common. The distribution of wealth is stark, with globally 20% of the world's population living on less than $1 a day. In sub-Saharan Africa, this rises to 43%. World Health Organization gross income per capita in the US dollars is estimated to be $1,372 in low-income countries. Note the massive disparity between this and that of high-income countries, where it's estimated to be $37,750. The 225 richest control the wealth equivalent to annual income of the poorest 2.5 billion people. Look at this map, which illustrates the proportion of people living under $1 a day, and compare this to our usual view of the world. Consider what it may cost to buy a coffee or grab a sandwich, and consider living on that amount for a day. It's clear and challenging. The situation is unequal. Low income is linked to higher mortality and lower life expectancy. A disproportionate 13% of world healthcare budget is spent on 8% of the population living in the developing world. Thinking about the prevalence of hearing loss in children, 4 to 6 per 1,000 live births, will have a moderate to profound degree of hearing loss. There's a much higher incidence of mild hearing loss. 2 to 5% of all live births are at risk for permanent childhood deafness. Research evidence suggests that the prevalence is higher than previously thought, rising from an estimated 120 million in 1995 to 278 million in 2005, rising to a level of 625 million if mild hearing loss is included. A quarter of this hearing loss is permanent childhood deafness, with an estimated 62 million deaf children under the age of 15 years. If mild hearing loss is included in this estimation, then there are thought to be in the region of 160 million deaf children. Annual births in the developing world are reported to be 120 million. Of these children, 798,000 will have a bilateral hearing loss, with 25% of all these children being sub-Saharan Africa. Stop for a moment and compare this to the 53,150 with permanent childhood deafness in developed countries. Let's just think about the global situation. Every day, 2,118 children will be born with permanent, significant sensorineural hearing loss. 1,972 of these will be born in developing countries. This equates to 6 per 1,000, where there is no early detection, no access to amplification, and no early intervention services. For the 146 born in developed countries, a rate of 4 per 1,000, such services are readily available. But for more than 90% of those born in low and middle income countries, the outlook is less favourable. Causes of deafness can be divided into two groups: primary preventable and genetic causes. Primary preventable includes infectious diseases and environmental risks. In high-income countries, 54% of permanent childhood deafness is genetic. In low-income and middle-income countries, there are multiple risks, including poor maternal health and childcare for things like high blood pressure, undernourishment or HIV, or an unskilled birth attendant, adverse peri- and postnatal conditions such as hyperbilirubinemia or the use of ototoxic drugs, consanguinity, marriage to a cousin, and infectious diseases such as measles and meningitis. In terms of infectious diseases, meningitis is the most common of all permanent childhood deafness in Africa, with the incidence of meningitis is 10 times higher than in high-income countries, with anything between 350,000 to 560,000 child deaths in Africa each year. Of those who survive, 1 in 3 to 1 in 5 will have hearing loss. There has been a strong increase in the uptake of immunisation against rubella. Nevertheless, there are thought to be 111,000 cases of congenital rubella syndrome, with between 70 to 90% of this group having a permanent sensorineural hearing loss. In sub-Saharan Africa, the World Health Organization reported that as yet there is no immunisation programme. In the 21st century, it is frightening to consider how many individuals are undernourished, whilst in developing countries, obesity is now a major health problem. 8% of the world's undernourished children live in 20 countries. A recent study was the first to link undernourishment in children to hearing loss, carried out by Olusanyo. These infants are significantly more likely to have hearing loss and of a severe to profound degree. The exact mechanism that causes this is unclear, whether it's a result of intrauterine growth retardation, maternal problems including mother's nutritional status, or insults arising from infectious disease at or soon after birth. Measles deaths, many still fail to recognise or do not understand the serious nature of this disease. Many of us take immunisation against measles as an obvious preventative step for our children. But many individuals in high-income countries have never seen the catastrophic effects measles can have. Whilst a vaccine was developed as long ago as 1968, measles is still rife in developing countries, accounting for 345,000 deaths in 2007, with 25 to 30 million children affected annually. Measles carries a significant risk of sensorineural hearing loss specific to these regions. HIV has been linked to tinnitus, vertigo and hearing loss in adults with HIV in a study undertaken in Pretoria and reported in the International Journal of Audiology in 2013. Malaria is a primary cause of hearing loss. There are at least 243 million cases of malaria, with 863,000 deaths per year, predominantly children under the age of 5 years. Reducing risks, important primary prevention strategy. This will rely on educating primary healthcare professionals in the importance of understanding primary causes of deafness and working with governments to address these issues. An upper limit of 50% of cases will be prevented this way. Infant hearing screening is an important secondary prevention, as this would allow the early identification of hearing loss.